Now, health experts are warning mothers about the negative impact of not practicing exclusive breastfeeding during early childhood. According to them, absence of exclusive breastfeeding for the first 2 years of the child may result in malnutrition and hinder bonding between the mother and the child. In the following report, we place our focus on the challenges faced by lactating mothers in balancing work and motherhood. This is a special room created by management of the Greater Accra Regional Hospital, otherwise known as the Rich Hospital, for staff who are nursing mothers. The room can accommodate up to 20 babies at a time, providing comfort and convenience for mothers. One mother, Mary, not her real name, who works at the Rich Hospital, has the privilege of breastfeeding her 7-month-old baby until the age of 1, thanks to an initiative by the hospital's management.
Because I knew if I bring her here, I would definitely get a chance to breastfeed her. So I was comfortable with it, and since then, it has been okay. They should provide facilities for mothers, especially those who are resuming from maternity leave, to get a place for their kids so that they will have the access to breastfeed them, because exclusive is better. Exclusive is better. So when they get a facility like this to breastfeed their children, I think the burden will be laid off and they will be okay. The supervisors here, all of them are nurses and they know how to go about babies. So I was comfortable and I was okay. I've not had any challenge in terms of breastfeeding, because every 2 hours I can just walk from my office and come here and come and breastfeed. After they giving the baby's food and all that, you can also come here and come and breastfeed. So it's been okay and it's been wonderful.
However, this opportunity is not available to most people, especially those in the private sector. Many mothers working in the private sector are only given a 3-month leave period after childbirth. Life after this grace period can be challenging, as some parents have to rely on helpers and processed meals. During the news team's visit to the Rich Hospital, we encountered a mother who had come for medical care. She recounted the difficulty in combining motherhood with work. She could not hold back her tears in her engagement with the news team.
Our facility don't help. As a nursing mom, you have to go to the washroom, use your breast pumps, excrete breast milk, and then you store it in the fridge. Then you take it home. Sometimes too, when it's too much, you just pour it away because the child is not there to take it at the moment. So you have to be doing that through every 2 to 3 hours, let me say. It really affects you at work as a mother, a new mother. Yeah. Because naturally the child has to feed from the breast, and then because of work and no facility available for the baby to be kept closer to you, you have to leave the baby somewhere, and then the breast will be filled up. Not talk of the pain you feel in your breast, the psychological trauma, like my baby might be crying and will need breast milk, and then you are unable to do that.
She expressed her wish for similar initiatives to be implemented in other workplaces to make childbirth easier for working mothers.
If the government can put in arrangements, a compulsory arrangement in companies, in facilities where baby centers could be created, at least one person available to be in charge of the kids, that mothers can go in, see their kids within intervals of 2 hours, 3 hours, breastfeed them, quick check on them, and then come back to their desks and work. I think it will be great help to mothers, because it's not fair and it's not easy at all. It really affects work and progress. That's the truth.
She's not alone in facing these challenges.
Whenever he's ready to breastfeed, I had to stop what I'm doing and breastfeed him. And it wasn't that easy because I'm actually at the KG. So when he's ready to breastfeed, I have to stop whatever I'm doing and attend to him. And fortunately for me, we were 2 teachers in the class. My son, when you express, he doesn't take the expressed breast milk. He wants it directly from the breast. So it wasn't easy, but I think if you comply, it's good. It makes the baby healthy. One thing that I would love is for them to extend the maternity leave, because since they advise us to do exclusive breastfeeding, probably they should extend it to 6 months. So after doing the exclusive, then if we can leave the children at home whilst they take the solids alongside the breast milk, it will be fine. Then when you go to work, we can work fully. But taking the child to work and then doing exclusive breastfeeding isn't that easy.
Health professionals are concerned about this trend, as it can lead to malnutrition in babies and hinder the bond between mother and child.
The first half of this year, children 0 to 11 months, where we have those exclusively breastfeeding being parts, we realize that out of 1,812 mothers who accessed the child welfare clinic, only 88 were moderately malnourished, and the contributing factors could be late initiation of breast milk, early introduction of complementary feeds, late introduction of complementary feeds, and poor position and attachment during breastfeeding could contribute to the moderately malnourished. But fortunately, we haven't recorded any severely malnourished within that age group.
Stakeholders believe it is essential to make provisions for lactating mothers working in private sector.